In this month's TAC Tic Talk, Jaclyn and I caught up with Dr. Carl Cleveland so that we could hear the story about his historic family and their 100-year celebration as Cleveland University, Kansas City celebrates this centennial event. This event will be occurring in late October. You don't want to miss it. Listen on to hear what Dr. Cleveland has to say. I'm Joe Busch. I don't know if you remember me. I'm with Jaclyn Touzard, the publisher of the magazine. We're siblings, but I'm sure you remember Jaclyn.
Of course. Yeah. In fact, I knew your father before any of you were born. So,
Wow. That's amazing.
Indianapolis, was that in Indiana or?
We're originally out of Indiana, and now so Fort Wayne, Indiana is where my dad had his clinic, our father, and then now we're in Republic of Panama.
Isn't that something?
Yeah, his semi-retired people always ask, how'd you get to Panama? I'm like, Indiana, tropical paradise of Panama. Which would you choose?
Yeah. Now, if I recall, your father was a Lincoln graduate. Is that the case, or was he Palmer?
He was Palmer.
Okay.
And like 69, right around that time, he had a daughter while in school. He always used to talk about the awesome rock band he had at that time to help put him through school.
Is that right? What instrument did he play?
Guitar and vocals.
Is that right? What do you know?
Mm-hmm.
Well, in my former life, I played keyboard and guitar. That's how I got through school. And in fact, that's how my wife and I met. I played. She played piano in church, and I played piano in nightclubs.
That's interesting. That's kind of very similar to my parents. Well, my dad always says that that's how he met his wife, or my mom, of course, in Indiana University. Well, they were going through their undergrad, but he was doing a rock band. She wasn't doing any piano at the church, but you know.
Well, and I went to church one Sunday. It was literally, what's a girl like you doing in a place like this? And we've been married over now 55 years. So
that's the place to find them, right? Well, we just wanted to get you to share your story, honestly, and help you promote your event and profile your life.
Just walking the talk.
We appreciate the recognition. And this centennial for us, first of all, I've been told by people I respect in the corporate world that an organization that can endure for 100 years, they must be doing something right. And so for us, this centennial is about honoring our past and celebrating the present, but also welcoming and looking forward to the future. So that's what we're doing this entire year. We've had the American Black Chiropractic Association put on their event here on campus this 100th year. At Cleveland, we've had the Association for the History of Chiropractic put on their annual convent here on the campus. The Gonstead Clinical Society is coming here in October. Motion Palpation Institute is coming. A lot of groups. And, of course, our biggest event will be from October 20th through October 22nd here at the Convention Hotel in Overland Park, Kansas. And Overland Park, you may not know, is a suburb of metropolitan Kansas City. And so we've got a lot to celebrate.
Great. Well, we're going to see if at least one of us can make it. We're going to definitely try to make it up there because I heard you have a great schedule. I was talking to Dr. Bill Owens. He talked about Dr. Edwards who's going to be there as a neurosurgeon on the program as well. Talking to Dr. Terry Yoakum about things you're doing with your radiology program. So, people can't stop talking about this event. So I would definitely encourage anyone who is in the area to get there.
So I would imagine one of your questions, well, how did this place called Cleveland University of Kansas City get started?
Okay, that's
a good question.
You know, let me check here because I have some extra notes here, Dr. Cleveland. Your grandmother and grandfather, along with Dr. Pearl Griffin, started Central Chiropractic College in Kansas City, Missouri in 1922, not long after their graduation from Palmer. It was renamed to Cleveland Chiropractic College in 1924. What drew your grandparents to chiropractic and to educating chiropractors?
Well, thanks for asking that question. It actually started in Lincoln, Nebraska, with a school teacher, a college teacher. Her name was Silva Ashworth. Silva Ashworth was a single parent. She'd raised all of her children by age 25. And she taught at Peru Normal College, which is Peru University today. And she had a series of health issues, part of which was diabetes. And her diabetes progressed so aggressively that she was being prepped for surgery because she had diabetic gangrene in her right leg and in her right foot. And as the story was related to me, the surgeons were prepping her for surgery, but then came back in and said, Miss Ashworth, we're not sure you'll even survive the surgery. We think you should go home, put your affairs in order. We know you have 4 children. Make out your will. You might have 6 months to live. So Sylva Ashworth literally went home to die. And she arranged for her children to be sent to relatives. And then a neighbor lady down the road asked a question, 5 words. Have you ever tried chiropractic? She'd never heard the word chiropractic. He's a new doctor in town. His name's Dr. Eaton. He's a chiropractor. He graduated from some college over there in eastern Iowa on the Mississippi in Davenport. Well, she had nothing to lose. I mean, she only had 6 months to live. And so she goes to Dr. Eaton, and Dr. Eaton proceeds with a series of adjustings in her mid-thoracic area. He adjusted other segments as the record was reporting to me. But after a period of several weeks, the gangrenous toes began to heal. Wow. And the chemistry of diabetes left her. She was so impressed with the outcome of her response to chiropractic care. And how do you explain that in today's concepts of evidence-based healthcare? Was it misdiagnosis? Was it spontaneous remission? Well, whatever the change that came about, she attributed that to chiropractic. And so she took 2 of her children, relocated to Davenport, Iowa, and enrolled at the Palmer School of Chiropractic and graduated in 1910. And she went back to Nebraska to be the first woman to practice chiropractic in that state of Nebraska. She organized the Nebraska State Association in her living room. She was quite an activist, quite a pioneer in chiropractic. And scandalous because she would go into the Nebraska State Penitentiary and put her hands on prisoners and adjust them. Now, put this in context. This is in 1910 and early 1920s. For a woman to be a doctor, let alone be a chiropractor, going into a prison, adjusting prisoners. I've got a copy of the newspaper clipping from the Des Moines Register. It was quite scandalous.
Take some moxie, definitely.
Without a doubt. First woman to have an automobile in Lancaster County in Nebraska, and it would backfire and scare the farmers' horses. But her daughter Ruth, the rest of this story, her daughter Ruth worked as a chiropractic assistant, Ruth Ashworth.
Okay.
Ruth asked mother the question, well, take me to the Palmer School. I want to be a chiropractor just like you. So Sylva, who studied under B.J. Palmer and actually knew Dee Dee Palmer, Sylva takes daughter Ruth to the Palmer School, introduces her to B.J. Palmer, and Ruth enrolls at Palmer. And she met a young fella in a class of anatomy. He was from Simpson College. He was quite the athlete. He coached baseball at Palmer, and they met in a class of anatomy, and they courted for a period of time. In fact, they got married. They got married in B.J. Palmer's home. B.J. gave away the bride. Mabel Palmer, B.J.'s wife, was the maid of honor. His name was Carl Cleveland. That was my grandfather. So my grandmother and grandfather met at the Palmer School, and they graduated, and they practiced in Webster City, Iowa. That was their first practice. And interestingly, a bit of chiropractic history, they sold the building, the practice, not the building, the practice to an L.M. Rogers. Why is that significant? L.M. Rogers, along with a fellow named Slocum, founded the NCMIC, the insurance company that supports the profession. And so I always tease my friends at NCMIC, Wayne Wolfson and Dr. Lou Sportelli, that organization got its start in my grandparents' office. And that's truly the case. But my grandparents relocated to Kansas City because you see, my grandfather was an athlete. In college, he participated in the decathlon, and he wanted to look at the influence of chiropractic on athletic performance and on fitness. And where do you go in 1917 or 18 or 19 to find people who are into fitness? And other than you could go to the colleges had athletic teams, and some of the high schools did. They went to Kansas City. Why? Because it had an active YMCA. And that's where people went for fitness back in the early part of the century, last century. And CS and Ruth built their practice around treating patients who were into athletic performance. And many of the patients said, well, can you teach us to be chiropractors? And they thought this through, and along with Dr. C.S. Cleveland's brother-in-law, P.B. Griffin, they started Central College of Chiropractic with 3 students. And it was among the early chiropractic colleges to be not-for-profit, and it continues to be not-for-profit today. Most of the chiropractic programs of that time were for-profit institutions. Palmer was a for-profit school of chiropractic. But Dr. C.S. said, we want to create an institution that will endure over time. And they did. Now 100 years, we continue to be not-for-profit. And so that's how they got into chiropractic education, and it was started here in Kansas City. But an interesting challenge was this. They started the college in 1922, but it was not until 1927 that the state of Missouri licensed chiropractic as a legitimate profession. And you've heard those stories growing up in a chiropractic family. The first state to license chiropractors was Kansas in 1913. But the last state to license chiropractors was Louisiana and Mississippi. And it took nearly 6 decades for all of the states to license chiropractic. Many colleges came and chiropractic programs were started and then closed, largely because it's tough to build a student body if you can't legally practice in the individual states. There were no funding for chiropractic education. And then we had the opposition of political medicine, which you know about, in that it was AMA's objective to contain and eliminate any of the competitors. And chiropractic was a competitor with a different philosophy of health. But in addition to that, there were competitors from an economic standpoint, because oftentimes, and your father will know this from his own practice, if he was a graduate in 1959, many of the patients that came to chiropractors were medical failures. They couldn't get results with medicine, and then as a last resort, and sometimes after expending a life savings, as a last result, they turned to chiropractic. And the chiropractor finds that the cause of the problem was spinal dysfunction that we call vertebral subluxation, that was interfering with the nervous system and the body's ability to express its healing potential from the brain to the body and the body back to the brain. So our role was to remove the interference to the body's ability to heal itself. And I know that the Busch family growing up as chiropractors know that the vision of chiropractic is far greater than the management of stiff neck, sore back, and headache. Now, I would admit that the bulk of our patients today come to us for pain management and spine care. But so that's how we started, and that's how we got to Kansas City.
So there used to be, that was pretty complete, actually. That was fairly complete.
Whoever gave me the bio was wrong.
Yeah. Now, so in the early days, there were all sorts of chiropractic institutions around, but now 100 years later, still Cleveland is open for business and seeing new students enroll. What sets you apart? How is that different than the other schools that didn't make it or thrive?
Well, the other institutions didn't survive largely because we had the opposition of political medicine. We had many of the states, no state licensure, so it was awkward to build a student body when you had the fear of the knock at the door bringing arrest. And we've had family members that have been committed to the principle of chiropractic that have sustained the organization now over 5 generations. My daughter and my son are doctors of chiropractic too. But you see, to put this in perspective, my father grew up at the college because the building that the college was in was their residence. It was a duplex. It was kind of an over and an under duplex with a unit upstairs and a unit downstairs. And sometime I can send you some photos. And the challenge was this: the college was where they lived. It was their home, but it was also the clinic where they treated patients. My father would say that the downstairs kitchen was converted to a chemistry lab, and the upstairs kitchen was converted to human dissection. He said as a child we had to eat all of our meals out because our kitchens were converted to laboratories. And I think an important part of this message is the rule at the house was if there was a knock at the door, he was to remain motionless, not to let out a peep, not a sound, until his parents could peek through the curtains to look to the front door to determine, well, was this caller a patient seeking care? Was it a student seeking to study chiropractic and become a doctor of chiropractic? Or was it an agent sent to arrest them for the illegal practice of medicine? Because the law in Missouri did not come about till 1927. My father would say, how did the chiropractors know when to answer the door? Well, this was back in the 20s. And unlike today, the police departments didn't have numerous squad cars or police cars. Policemen literally walked the beat. And the chiropractors noted that the city council here in Kansas City, Missouri, would issue a special regulation boot that was conducive to walking. So when there was a knock at the door, they peeked through the curtain. If it was the regulation boot, they didn't answer the door. So this profession has come a long way since a time when a knock at the door brought fear of arrest. And you know this, and I've read your featured articles. You know that today chiropractic's practiced on over 200 in 200 Veterans Administration hospitals and facilities, on 66 military treatment facilities. You know that in addition to chiropractic being in the Department of Defense and Veterans Affairs, that chiropractic is now integrated on all of the 32 Major League Football teams, 28 of the 30 Major League Baseball teams. In the Olympics, I know you've reported on chiropractic in the Olympics over the years, for now over 2 decades. Congressional Services engages chiropractors to treat the elected officials on Capitol Hill, from Cerner to Cisco to Twitter to Target. They all have workplace wellness centers in their corporate facilities that engage doctors of chiropractic. So we've come a long way as a profession. In fact, in addition to that, there are residencies at Yale University Medical School that takes chiropractic graduates and trains them in informatics and research to be able to do data collection and analysis of cost-effective, pain-free, non-pharmacological approach and that's Yale University. So
it has to fill you with such pride, right? To know that your family had such an influential role in the development of that, and just to be a member of the profession and watching over it as a leader, right?
I couldn't think of, for me, people ask me, Carl, don't you miss private practice? And of course I do. I miss the patient care. But for me, being a president of this institution, it's like having a high volume practice, in that I'm sending graduates across this United States into foreign countries. And that's what's exciting for me. If I may digress for a second, I remember we had a graduate here at the Kansas City campus. His name was Jello Bellawari. He was from Morocco. And he wanted to be the first chiropractor to go back into practice in Morocco. That's in northern Africa. And he graduated. He's an excellent student. He goes back. But chiropractic's not licensed there. It's not recognized. So they kind of give him a physical therapy certificate. They give him no respect at all. He gets to see a few patients. But he was a bit of an outcast. And but I haven't memorized the dates, mid 80s, maybe 85 or 86, Morocco had their first Olympic athlete. It was the same year that the U.S. boycotted the Olympics because of Russia's some unjust civil rights issue. You might you were not old enough
Sure.
to
Yeah.
remember that, but that occurred. And interestingly, the Moroccan athlete, he was a track and field athlete. He injured his hip and his leg and his low back. Well, the King's orthopedic surgeons couldn't fix it. The King's physical therapist couldn't fix it. You probably know where I'm going with this story. They turned to Jello Belloare. And of course, the influence of chiropractic, and it was a structural problem. And Jello Belloare, Dr. Belloare, practiced what he learned here. And the athlete was back into training and competed, won a gold medal, a silver medal. And so I've got a photo here in my office of Jello Belloare next to the Prince and the King of Morocco. He's now that was then the King's chiropractor. And he wrote me a letter soon after that. He said, Dr. Cleveland, I want you to know that the number of chiropractors, the chiropractic profession in Morocco, it has increased to 100%. And I said, well, happy to see that. He says, yes, it increased from one, who was me. It has now 2 chiropractors. So I'm not sure how many there are at this point in time. But when you think about that, think of the global reach that this profession has. And so why do I come to work every day? It's because we change lives. You know about that. For the same reason
Absolutely.
you have followed your father in creating the word and the vision for people to read around the world.
So, Dr. Carl, as a 4th-generation chiropractor and member of a pioneering family, you have personally known many luminaries in the profession. Can you talk about, who's your favorite, or give a couple of your favorite?
Well, my favorite would be my grandfather and my father and my mother. They were my mentors. Because you see, in my family, my great-grandmother was a chiropractor. My grandfather and grandmother, they were chiropractors. And my mother and father was a chiropractor. As a child, I thought everybody grew up to be a chiropractor. We didn't take vacations. We went to chiropractic conventions. And the last thing that I ever wanted to do as a child, you know what I'm talking about. You've been there.
Same.
Was to be a chiropractor. I didn't want to do that at all. And in fact, there's some photos circulating around. When I was a very young child, they would drag me up Brady Street Hill in Davenport, Iowa in August, and we'd sit in a tent. They called it Lyceum. And just hundreds of chiropractors would gather under that tent. It was really kind of a Palmer homecoming. And they forced me to sit on the front row in a folding chair in a tent. Have you ever been in a tent in August in Davenport, Iowa? It was hot. It was miserable. They dressed me funny in this little starched shirt and put a bow tie on me, had me sit there on the front row. They forced me to listen to J. Clay Thompson, the founder of the Thompson technique. They forced me to listen to Clarence Gonstead, the founder of the Gonstead technique. And as a child, I still remember the stench of B.J. Palmer's cigar. So I grew up seeing those pioneers. In fact, right out of high school, before I went into college, I was on the International Chiropractors Association. They had a international conference. It was in Europe. And I went along. It was a graduation present from my father and mother. But I wasn't in chiropractic college, but I had grown up in chiropractic. And there was a tour. It started in London, and then it moved over to the European continent, and they'd go from city to city, and there were different lecturers. And the bus that we were on, there must have been 200 chiropractors, and we'd be divvied up in these tour buses. You can imagine that. Well, on the bus that I was on was Clarence Gonstead and his wife, and also William Blair. You may not be old enough to remember the Blair upper cervical technique.
Yeah,
sure.
He was on there too. DeJarnette, that developed the SOT technique, and I just wished I would have known what questions to ask now that I've gone through chiropractic. And in fact, this January of 2023, I will have taught in the classroom here at this institution 50 years. And so I'm really honored that I had, but I resented being in that chair in August in Davenport as a young child. But today, I wouldn't change those memories for anything.
Well, I'm going to have to make my kids listen to this interview now, Dr. Carl, because it's for their own good, right? So now Cleveland distinguishes itself for its remarkable results on the NBC exams. How do you guys accomplish this?
Well, I am honored to know that now 6 years in a row, and the data speaks for itself because as part of the accreditation with the Council on Chiropractic Education, each one of the chiropractic programs is to post its national board performance. So that's a requirement. And I'm happy to see that consistently Cleveland has been at the top of all of those institutions. People from my colleagues, other college presidents, say, how do you stay at the top? We've been at the top for now 6 years consistently. And I'm putting a lot of pressure on my students and my faculty to keep us there. And I think it's attributable to a very strong curriculum and very good faculty. And I've got to give the students credit too. So I think those are the main reasons. But you see, Cleveland's, I would like to think it's more than board scores. When you look at our default rate, it's nearly zero. And when I say that, I'm talking about the financial aid default rate. That says to me that the bulk of our students are taking what they've learned here at this institution, they're applying it out into the business community, they're paying back their student loans, and they're enjoying the dream and the lifestyle of chiropractic. So I think there are multiple factors.
What is your personal vision for the future of chiropractic?
Interestingly, within just going back to November here of 2022, have been in a series of phone calls with the leadership of different medical organizations, and it's interesting to see the change because from my perspective, there are at least 5 dynamics that are moving this profession forward. The first 3 represent the triple aim of healthcare. And when I use that reference, it was proposed by a medical doctors, epidemiologists, Withington, and the others, Berwick and Withington. And it was part of congressional testimony. It goes back to 2008. And the recommendation was that if our government really wants to impact healthcare in this country, then the decisions and the procedures should be driven by meeting 3 objectives. First, does the procedure have evidence of being effective? Number 2, is there evidence that the procedure saves cost? And number 3, are the patients satisfied with the outcome? And when you look at the research, the outcomes research with the effectiveness of chiropractic, at least with managing back pain, neck pain, and headache, hands down, you've seen the data. If the patient goes to a chiropractor first, maybe 40% less cost overall to get that patient back to work. And so we have the research pointing our direction. We also have cost effectiveness study after cost effectiveness study, but we save the system money. Gallup poll to Consumer Reports studies, surveys of patient satisfaction. Patients love their chiropractors. Those are the first 3, and that's the triple aim. The fourth dynamic that's moving this profession forward is the tragedy of the addiction to prescribed drugs. You've seen it. Your journal has written about it. And so as a result, the guidelines, medical guidelines, this is going back to 2017, you had the American College of Physicians, you had the Page study in the Journal of the American Medical Association, you had the Canadian Medical Association guidelines, as well as our own country's Food and Drug Administration. Guidelines for pain management first look to non-pharmacological procedures, and they list massage, and they list acupuncture and osteopathic manipulation, and they list chiropractic or spinal manipulation. So all of a sudden, very abruptly, chiropractic has been thrust in to being a solution to the addiction to prescribed drugs, and that's opened up a tremendous number of doors for this profession. The fifth dynamic moving the profession forward is the aging baby boomer. You may have seen them. They were born between 1946 and 1964, and there's a whole lot of them. And they drove social change in the 60s and the 70s. That was far before either of you were born, but you've probably read the stories. There are elected officials in Congress today, and in fact, the AARP indicates that 10,000 baby boomers turn 65 every day. Now, when you think about it, there are new attitudes about aging in the minds of the boomers. They start careers, they volunteer their time, they go back to school, take on new hobbies, they travel. You see, my image of old age for the generation of students that, if I were the age of our students that we have today, my image of old age when I was younger, it was 65 years old on the front porch in a rocking chair. Today, the image of old age, 85 years old on a Carnival singles cruise. There are new attitudes about aging. And what profession is better positioned to usher those aging boomers into their golden years than doctors of chiropractic? To minimize pain, to improve function, to improve balance, and this is our finest hour. Oh, back to my conversation with my new medical colleagues starting back in November. We have major hospital systems. The conversation that was presented to me was, we have so many patients present in the emergency rooms that are in pain, typically musculoskeletal pain. We're reluctant now to give them painkillers. They don't need surgery. They haven't broken anything. We've been sending them to physical therapists, but we've read the research. We think it makes sense to hire doctors of chiropractic to work in those emergency rooms to take on those patients. Now, this is a long-winded way of getting back to your question. Where do I see the future? The future is the present. And what we have to do as chiropractic educators is prepare our graduates to work in what I will call multidisciplinary centers, not to practice medicine, but to practice what we do and they don't, but in a system that provides chiropractors access to far more patients. You see, if the Gallup poll, the Palmer-Gallup study, if they're saying that we saw 14% of the population over the past 12 months of that study from back in 2017, getting chiropractic in these multidisciplinary settings gives us access to the other 85% of those patients. Sometimes some of my colleagues, our graduates, say, well, Cleveland, why don't you just train us to be out and be good adjusters, and why your interest in we're working out these cooperative relations with the medical system. They used to want to put us out of business. Yes, they did. They tried that. Attitudes are changing, but it's not about the medical system for me. It's about our graduates having access to patients that need our care. The patients win, our practitioners win, the image of this profession, it's a home run on all levels. So my vision of the future, I'd like to see that this profession do for chiropractic and the minds of the public what dentistry did in the 1950s. They took dentistry from an image of toothache to an image of oral hygiene and prevention. Mm-hmm. I see the day where we've taken the image of chiropractic from back pain and pain management to spinal hygiene and to wellness and to function, so that you're going to your chiropractor on a regular basis to maintain proper spinal function so it does not deteriorate in terms of your mobility, degeneration of the joint, irritation of the nerves, and a cascade of symptoms that may occur as a result of that. There are only 77,000 chiropractors nationwide compared to some 900,000 medical practitioners. So there's a tremendous opportunity for growth in this profession, without a doubt. And when I see our graduates being able to pay back their loans, and I see that low default rate, and our industry across the profession, the default rate's low compared to other institutions in higher education, that tells me they're out there serving the community and paying back their debt and living the dream of a practitioner of chiropractic.
Very inspiring. Can you tell us a bit about the Cleveland Centennial Midwest Annual Conference and Expo? who should attend and why, and what kind of platform are they going to have there?
Well, you've seen the list of speakers, over 30 some speakers across a variety of disciplines, from animal chiropractic to pediatrics to women in chiropractic to sports to, I mean, when you look at some of the names, Claudia Onrig, Britt Batchelor, Leo Bronston from the ACA, Richard Brown from the World Federation of Chiropractic, a global approach. Add to that James Chestnut with his wellness movement, Donna Kraft with Women in Chiropractic, Louis Crivelli with the Clinical Compass, you know about that organization, John Edwards, as you mentioned earlier, a medical doctor, a neurosurgeon that is part of Bill Owens' movement and this new concept of chiropractic spine care management. We're part of that postgraduate program. And again, it's one more, it being the spine management project, is one more educational track to prepare doctors of chiropractic to work within those multidisciplinary settings. You have Bill Esteve, Ray Foxworth, those are names that you know. Kent Greenewald, of course, will be there. He will be speaking. Heidi Havoc, which was one of the most published researchers in the profession. Scott Haldeman, which goes back to your father. In fact, Scott Haldeman and your father may have been classmates there at the Palmer School if your father graduated in 1959. Anthony Lisi from the VA. We have representation from the practice management groups, from Integrity to Mark Santa to Pinnacle, and so many others. And Sherry McAllister from the Foundation for Chiropractic Progress. She will be part of the presentation too. We've got an animal chiropractic segment. Emily McLeod, she tells me I'm actually bringing horses and dogs on site to the event for demonstrations. And of
Why
course,
not?
Why not? Michael Perush with Cats Management, Guy Riekman, who you know, and so many more, and Selena Sigafus from the ICA, and so we're gonna have an impact. And you mentioned Terry Yoakum and his daughter Alicia, so there's something for everyone. Come away with 20 hours of license renewal, but we're gonna have a celebration, some music, some entertainment.
Carl, your memory is sharp as a tack. You remember everything I said already, but I do think that my dad graduated in '69. Just so you know, so I think there was a difference there. So probably not with Scott, but that's
okay. All right. Well,
I was writing that down. I was like, "Is Dad really that old?"
No,
well,
69.
I thought I heard that from you, so my apologies.
He says he's a pretty fast dancer, but not that fast, Jaclyn. No.
Okay. So he graduated in '69. Okay.
Yeah.
Well, he's a youngster.
Right. Yeah. Exactly. He's spring chicken, right? What year did you graduate? Now you must have graduated in your 20s or something.
1975 is when I graduated.
Yeah. Okay. But
I started teaching here in 1973 because I was in graduate school as a teaching assistant in the Department of Biology, and before I started Chiropractic College, actually, I told you that the last thing I wanted to do was to grow up and be a chiropractor as a child and as a teenager, and I had two goals. Goals. One was to be a pianist, and I played in music. And the other one was to be a herpetologist. Now, a herpetologist is someone who studies reptiles and amphibians, snakes and lizards and turtles. And I was working one evening. It was in the Baghdad Lounge here in Kansas City. And I was in undergraduate college. And they smoked back in supper clubs back then. And I just got to thinking, I don't want to be 30 years old playing piano in a smoky nightclub. And there wasn't a big market for somebody that collected snakes and lizards. So I thought, well, maybe what Dad did wasn't so bad. I'll go into chiropractic and I'll go into practice, but I'm never going to go into teaching or into administration. I'm going to...
Never say never, Kyle. Never say never.
Man plans and God laughs, and now look at where I am. So
exactly. No, well, hey, it's a success story. So, well, if you could give any advice to a person considering chiropractic as a career, what would it be?
I often talk with more graduates. In fact, the first day of class, I still teach. I teach Introduction to Chiropractic Principles and Philosophy and Science in the first term, like my father and his father before him, years before. And first day, I have them stand up and I have them tell their chiropractic story. How did they become interested in chiropractic? And it's interesting to hear the moving stories and all of that. And then when I, at the end of the program, in fact, today's graduation, I'll be preparing for that here in a few moments after our call. And last night we had a president's banquet, and I talked to them and their families as I'd walk the tables, and I'd say, what would you have done different? And so many of them have said, the only thing I would have done different, I would have started chiropractic college earlier. I would have made this decision earlier, especially the career changers.
Mm-hmm.
And so what advice would I give to someone considering chiropractic? Take the action step. Go visit a chiropractor. Shadow a chiropractor. See what it's like. See if it's right for you. We have students that shadow physical therapists before they come in, and then they would shadow a chiropractor. And oftentimes they come back and say, they have so much fun in the chiropractor's office, and I really don't want to stand there with a machine watching the patient exercise for hours. And so my advice to someone considering chiropractic, go observe in a chiropractor's office. If they don't know one, call us here in admissions, wherever they are across the country or the globe, and we'll find some chiropractor. He may not be a Cleveland graduate, or she may not, and sit and watch a chiropractor and see what they do. And if it has appealed to you, then make contact with the closest chiropractic program that's available to you and go tour it. And boy, it sure is the best decision I have ever made. And when you think about it, what a doctor of chiropractic degree provides, they become independent businessmen and businesswomen. They can set their own hours. They're with a Cleveland diploma and a diploma from any of the accredited colleges. They can go to all 50 states, to some 40 countries. But what's so good about being a doctor of chiropractic, and yes, you're going to contribute to your own family's wealth and lifestyle, but also that of the community. But most important, for that factory worker that can go into the plant on Monday morning, earn a day's wage, pain-free, because of the chiropractic care, that chiropractor is going to be the hero. Or maybe it's the third grade teacher that can now go into her class free of migraine headaches. That chiropractor is the hero. Or maybe it's the corporate executive that simply wants to improve his golf swing on the weekend. The chiropractor becomes the hero. I mean, think about that. Someone who is graduating today with a doctor of chiropractic degree, they have the independence to set their own hours, to be their own boss. But most importantly, they will enjoy the genuine gratitude from men and from women and the children whose lives they change through chiropractic, through these hands. That's what I'd tell somebody considering chiropractic.
Outstanding. Well, you're a living legend, Dr. Carl, and so we're both looking forward to the event up there in Cleveland. Hopefully, we can make it, but you'll definitely know if we're there. So, Jaclyn, did you have anything that you wanted to ask Carl?
Two quick questions, because, and I know I don't want to extend it too long, but Dr. Carl, I wanted to get in here and ask one, of course, from a patient perspective as the publisher. And I'm always, I'm the non-doctor, I'm the communicator, but I'm always thinking of the patient. So if you could give just one piece of advice to a patient who has never tried chiropractic before, what would it be?
Well, talk to other satisfied patients and take the action step and try chiropractic, and it could change their lives. Growing up as a child in a chiropractic family, and you know this being second generation family of chiropractors, the public over the years has had different perceptions of what chiropractic is. And I recall as a child, I would be with my friends, and one little girl that lived up the street, I was about 7 years old, and it was a sunny spring day, and on Saturdays we would play baseball with the neighbors. And I was waiting for her to come out, and she came and she plopped down on her cement step and said, "My father says your daddy's bad." my father says your daddy's a quack. Well, I never heard the word quack in that context. I know it was an expression that a duck made. In fact, it wasn't very long. I'd be playing baseball, and the kids in the neighborhood, I'd be up to bat, and I'd be ready to swing, and they'd say, "Go Quactor C, go Quactor C." That was my nickname through high school. And the point I'm making is the perception of my grandchildren and your grandchildren or children aren't going to hear disparaging words like quackery. Because today's image of chiropractic is far different. And if somebody would ask me the question, what's my why? It's that every American knows and understands and respects the value of chiropractic. That's my mission in life. And so I spend a lot of my time in front of lay groups explaining what is chiropractic, what's the introduction to chiropractic. I've been honored to write a booklet for a Foundation for Chiropractic Progress. In fact, it's going to be released next week at the Florida National. It's a second edition. It's called Chiropractic, a Safe and Effective Approach to Healthcare. I don't receive any royalties. I was happy to donate my time to put this together, but the booklet is to be a piece that any chiropractor or anyone who is interested in the profession can read and understand in lay language. What is chiropractic? Where does it fit into the system? Where's the science and the research? But it's written for a lay audience. What are the qualifications to be a doctor of chiropractic? I'm surprised. I run into people, members of the public, when they say, "You mean it takes 4 years to be a doctor of chiropractic?" You've probably experienced those same questions. And if they don't understand our training, they question our competency. So the message we've got to deliver is, here's the research, here's the cost effectiveness, here's the safety. Far safer that I get a cervical adjustment than take an opioid, for sure, or even an NSAIDs. So the burden is on us to take the science out to the public and to the decision makers. And the science doesn't advocate for itself. We have to get out there and communicate it. And that's what you're doing through your journals. And I've read the articles, and many of what you write about is information that practitioners can use in their lay lectures or to share with their medical practitioners to open up the eyes and the door, saying, here's what modern chiropractic is today. So I thank you for that.
Well, and I wanted to wrap things up saying, when we were picking out the name TIC Talk for this podcast program, because it's all around the chiropractic, of course, talking points. And, there's, to me, in chiropractic, you could probably define that what is the TIC for you to make it distinguish between anything else. But we wanted to make sure this is a unifying program for a podcast around chiropractic.
Well, I'm happy to hear this. Interestingly, you may or may not know this story. I talked about my grandparents. My grandfather, C.S., and my father stayed aligned with B.J. Palmer and the International Chiropractic Association. But my grandmother, Ruth, and great-grandmother, Silva Ashworth, stayed aligned with the National Chiropractic Association that became today's ACA. And as a child, I'd go to a Thanksgiving dinner with the family, and my relatives seated around we couldn't get past the salads, and they'd be talking about the personalities in the ACA and the ICA. And so I grew up understanding, there's a difference in philosophy. Interestingly, before that Thanksgiving weekend was over, I'd get 2 or 3 adjustments from my relatives. They'd all adjust me the same way, but yet there's a different perspective and philosophy. So when I came into leadership at this institution, I made the decision, we're going to have a student ACA and a student ICA. And we have that yet today. Some of the other colleges followed suit. I joined both the ACA and the ICA for all the right reasons. And we pay for our students to be student members of those associations, as well as the American Black Chiropractors Association. Why? My charge to them today at this graduation and every other graduation is your responsibility as graduates. Your first year is to join your state association. And the second year is to join one of the national associations of your choice. That's a unifying factor. That's a unifying message, and for all the right reasons. So, interestingly, I was at a fundraiser with my wife Elizabeth and some friends here. It goes back a few years. It was to the Kansas City Philharmonic Orchestra, and it was kind of a black tie, and we go to the event, and they had the table settings, and I was with an accountant friend, and the They told us which table to go to, and there were 6 people around this table. A very festive event, and 4 of them I bought tickets for, and there was a woman and her husband sitting there before we got there, and they had nameplates, little name cards, and one of them said Dr. Dr. Carl Cleveland, so I knew where to sit. And the lady that I was sitting next to said, "Well, I see you're Dr. Cleveland. What type of doctor are you?" And I said, "Well, I'm a doctor of chiropractic." And she says, no, what type of a chiropractor are you? I go to my chiropractor. He's handled my migraines. I love my chiropractor. But what type of a chiropractor are you? And I said, well, I thought to myself, well, I'm college president. I'm a very competent one. Why do you ask? She says, no, are you a straight or are you a mixer? Now, can you imagine getting that question from somebody at that fundraiser that was a non-chiropractor? Now, what do you think my accountant friend and his wife think that woman just asked me?
Some scandalous kind of question, right?
Am I a straight? Am I a straight? In other words, was she asking me how I like my cocktails, or was she asking me my sexual persuasion? You see,
Right.
we've dealt with some diversity within this profession, and one of many things that make Cleveland unique is we embrace that diversity, but try to get the profession looking in a unified direction. And I think we've got some success with that. I know I've probably gone out over time. Hope we've addressed your objectives. Hope you tell your friends about our big event, because you're going to hear some of those stories about the pioneers, and you're going to hear some of the best of breed in technique and in education. And we're looking forward to it. And for us, 100 years, it's just the beginning.
Hey, thank goodness. So nice to see you, and look forward to seeing you.
Talk to you soon.
Great.
Thank you.
See you soon.
Hey, thank
Bye.
you.